Hey there, I'm Holly, a functional nutritionist with a Bachelor of Science in Nutrition, and I want to talk to you today about heartburn, reflux, or GERD, whatever you want to call it. If you're struggling with heartburn, reflux, GERD, or silent reflux, aka LPR, this has been a huge part of my journey, and I want to empower you to understand why you have it and how we can treat it so you don't have to suffer and limit your favorite foods for the rest of your life. So yes, there are foods that are trigger foods for heartburn and reflux, things that actually loosen your esophageal sphincter. So we're talking about cinnamon, dark chocolate, alcohol, fried foods, tomatoes, mint, onions, and garlic. So these are all delicious things that we don't want to avoid, right? So when we treat the root causes of heartburn, we can bring those foods back in without problem. Now, what are these root causes I'm going on about? Number one is low stomach acid, especially if you are on an antacid or have been on an antacid and you noticed maybe less burning coming up your throat, but now you still have this sensation of food stuck in your throat. You're always clearing your throat. You're feeling full all the time and gassy and bloated. Odds are it's because you have low stomach acid. We need that acid to trigger the sphincter between our stomach and our esophagus to tighten so things are not coming up. So when someone's on an antacid, they have what we call WAR, weakly acid reflux, where yes, you're still going to have a small amount of acid and it's coming up because there's not enough acid to trigger that sphincter to tighten and close. And the other issue I see a lot with people, two other things actually. Number one is something called SIBO, small intestine bacterial overgrowth. Especially if you have been chronically constipated, you've had surgeries or concussion, you've had some bad gut infections, and especially if you've been on an antacid like pantoprazole, Nexium, Pepcid, whatever you want to call it, prescription strength antacids for a long period of time, puts you at risk of having SIBO, small intestine bacterial overgrowth. Most of your gut microbes are supposed to be in your lower gut, your large intestine, and colon. When we have these other underlying factors like low stomach acid, chronic constipation, those bacteria are able to migrate upward and live more in your small intestine. We don't want them there because your small intestine is where you digest and absorb your food. And we can't do that properly, and we're going to get lots of gas and bloating and indigestion if there's too much bacteria there. On top of that, we can get really bad heartburn and reflux from having SIBO, because the pressure, the gas that is produced by all this excessive fermentation in your small intestine from that bacteria pushes upwards and causes the contents of your stomach to reflux upwards, especially if that's combined with low stomach acid, which is usually the case with SIBO. The final thing is something called H. pylori. H. pylori is a type of bacteria that is quite difficult to treat. And yes, sometimes you do need antibiotics, but I do use specific protocols that using natural supplements and dietary changes to help you eradicate H. pylori. Usually people have H. pylori if they have a lot of, they've had ulcers or they have chronic gastritis, the stomach pain and irritation, especially when their stomach is empty. They might have chronic acid reflux despite trying everything, and maybe they've even worked on treating their SIBO and they still have acid reflux or silent reflux. They've got, aches and pains and brain fog and lots of inflammation. H. pylori can cause a lot of systemic issues. So when we have an issue there, we can do testing to find out, is it H. pylori by doing a breath test, a stool test, and there is a blood test for antibodies as well. Just because you have it, though, doesn't mean we have to treat it or eradicate it. We want to know, how much do you have? Is it there? How much is there? And is it actively causing inflammation? I use a stool test called the GI map to figure out, is this H. pylori causing a problem for you? And that's figured out by looking at virulence factors. I believe there's 6 or 8 virulence factors that tells us whether the H. pylori is actively causing inflammation and issues in your gut. If it is, we make a treatment plan to eradicate the H. pylori, and once we do that, your heartburn, indigestion, food sensitivities, and even things like inflammation and brain fog get so much better. So I want to empower you to understand, once again, that treating heartburn doesn't mean staying on a restrictive diet or taking antacids for life. In fact, doing these two things can often make it worse and set you up for other health issues as well. So I really empower you to learn more about why you're having this heartburn and this reflux, get to those root causes by working with a practitioner like myself, and get you off those diets so you can enjoy food again.